Bolbinaka, Fiji. Last night, one of our COVID positive patients, a woman from the recent Makoi cluster, was entered into intensive care after her condition began to deteriorate rapidly. I am sad to report that despite the best efforts of her attending physicians, she passed away. We informed this woman's family of her passing and offered them our sincere condolences well before making this announcement to the nation, as we wanted them to have time to process this bad news privately. Tonight I offer the nation my ministry's total commitment to spare as many families as we can. From the tragedy of seeing loved ones lost to a terrible disease. This is our second reported death from COVID-19 due to this outbreak. It serves as yet another painful reminder of the severity of the threat that we face. We are dealing with a virus that has claimed more than 3.7 million lives around the world. Many more Fijian lives could all too easily add to that sobering figure. But that does not have to happen. The war against this virus is still winnable. Many thousands of lives can still be saved. Today, tomorrow, and every day. After all, for the foreseeable future, we can tell you what steps you can take to protect yourselves and protect the ones that you love. Listen often, listen well, and please adhere to every word of advice that we have to give. Today, we have another 4 new cases of COVID-19 to report. The first case is from Makoi, presented to the Oceania Hospital with symptoms. At this early stage of the investigation, this case has no known links to any other case. The Oceania Hospital Outpatients Department was temporarily closed yesterday for contact tracing and decontamination. Anyone who potentially had contact with this case at the hospital has been quarantined. The next case is also from Makoi and is an administration staff of the Fiji CDC. According to Fiji CDC protocol, he was tested after he returned from annual leave this week. The next 2 cases were administrative staff at the Fiji CDC who had tested negative during routine testing earlier this week, but was positive as part of the contact tracing of this new case. The 3 staff have been tested positive for the virus and have been transferred to isolation facilities. Our investigations so far indicate that this cluster originated outside the Fiji CDC and the virus was then brought in, as would be an expected consequence of community transmission. Apart from these 3 cases, all other Fiji CDC staff have tested negative so far, including all of the laboratory and medical staff at the center. We know that there was limited contact between the administration staff and the laboratory personnel due to existing protocols. However, as a result of these cases, Fiji CDC has been sequestered with staff on site or placed in quarantine facilities. Testing has temporarily halted while the decontamination is being completed. The on-site staff will continue processing samples after decontamination of the facility, and they will be tested and retested frequently during the sequestration period, similar to what is currently happening at Lautoka Hospital. As for our other active cases, thousands of Fijians received text alert yesterday alerting them that they may have been contact of some of the new cases confirmed at Extra Supermarket. Our contact tracing investigations has since narrowed that number of contacts, and we have let some of those people know that they are no longer considered to be a high risk of exposure. But I hope the experience has taught everyone how easily even one case can spark an outbreak, and how high the risks are of leaving your bubble whenever you do. It has also taught us how vitally important it is for all of us to be using the FijiCare app and have your Bluetooth or switched on whenever you are in a public place. There are currently 52 known active cases of COVID-19 in the country. From that number of cases, there were already thousands of primary and secondary contacts, stretching my contact traces to their limit. Care Fiji eases that growing burden. Its technology does not depend on the limits of human labor. The app does not get tired. It does not take breaks. It works 24/7 to save your lives and the lives of your loved ones by stopping the virus as quickly as possible. It does not drain your battery, nor does it burn through your data. Anyone who tells you otherwise is lying. Right now, the pandemic in Fiji is only a spark. But if that spark isn't quickly and aggressively extinguished, a tiny ember is all it takes to start a massive, uncontrollable wildfire that claims thousands of Fijian lives. That's why we are taking very aggressive measures. Our goal is elimination. We must dedicate everything we have into putting this flame before it grows. Yesterday, we announced the lockdown of the Suvarnasori containment area to commence from tomorrow night at 11 p.m. until Tuesday morning. Given the rapidly rising number of contacts stemming from the new cases of COVID-19 in the Suvarnasori area, that lockdown has been extended until Wednesday, the 19th of May at 4 a.m. Fijians living in the Suvarnasori containment areas are urged to make appropriate preparations for an all-day stay-at-home order that will remain in force from Friday evening, the 14th of May at 11 p.m. until Wednesday morning, the 19th of May at 4 a.m. The rules of the lockdown will be the same as last time. No one should leave their home. No businesses should be open except those that have been given explicit permission to operate. Movement for medical emergencies is the only movement that will be permitted for members of the public. Otherwise, it will only be the police, my contact tracers, food ration delivery teams, and other essential service providers on the streets, no one else. As I explained yesterday, food rations will be available during the later stages of the lockdown period for Fijians living within the Suvarnasori lockdown zone who have a genuine need for emergency food supply. Outside of the lockdown zone, the borders of our containment areas will remain firmly in place for the foreseeable future. We believe this virus is still circulating in Nadi, in Lautoka, in Rekereke, in Lami, and potentially throughout the rest of Viti Levu. As announced yesterday, to further restrict the movement, the 6 p.m. until 4 a.m. curfew will take effect from this Saturday for the rest of Viti Levu. While our full freedom of movement must be sacrificed through the lockdown period, this is more than a necessary sacrifice. We are at war with an enemy devoid of mercy, an enemy that preys on the most innocent of exchanges, a maskless conversation, a handshake, a hug. But we have tactics that defeat this enemy, and we know from experience that going hard early can secure us a victory. The virus stays alive by passing from person to person. In doing so, it debilitates medical capacity. It deals death to those who are most vulnerable. But this virus needs us to survive. It needs people in order to survive. Without opportunities to spread to other hosts, the virus dies. Physical distance of at least 2 meters can stop the spread. Masks, when worn widely by everyone, can stop the spread. Good hand washing can kill the virus. But nothing, and I repeat nothing, kills the virus more assuredly than staying at home. If everyone stays home, the virus will have nowhere to travel. Eventually it will die. If everyone respects the rules we have in place, the virus will die. But on the contrary, if the rules are broken, Fijians will die, not the virus. In some countries around the world, The public and even at times governments have failed to take this virus seriously. They continued on with normal lives, breaking rules and skirting restrictions. We're seeing that pattern emerge in Fiji, and this complacency is unacceptable. Our citizens in some countries other citizens in some countries waited for a famous celebrity, a sports hero, or more of their loved ones to die from COVID-19 before they recognized the severity of this pandemic. By that point, it was too late. As we watch news of funeral pyres being burnt in India or mass graves being dug in Brazil, we see that even one case can grow to devastate a country beyond recognition. Tragedy has given us a small glimpse of how serious this virus can be. 2 lives have already been lost. What will it take for us to recognize that COVID-19 won't magically disappear on its own? The death of our favorite rugby player, our religious leader, your neighbor, your mom, your dad, your spouse, your brother, your sister, your grandparent, or your children? The power to protect them is in your hands, so watch them often. And please heed my words. Stay at home. Stay in your bubble. Lockdown or not, home is where you ought to be. The harder we come down on this virus now, the sooner this will be over. I asked you before and I ask you again, keep the faith, Fiji. If you're running a business that has been closed, keep the faith that you can open again once it is safe to do so. If you're running a school, keep the faith that classrooms can open once you have killed off this virus. If you are unable to work, keep the faith that you will work again once Fiji is COVID contained. If you are working in our hospitals, guarding our containment areas, tracing COVID contacts, or working in our CDC labs, keep the faith that your fellow Fijians are with you and that they are prepared to make the sacrifices we need to stop the spread and end this outbreak. We are fighting for the sake of normalcy. We are fighting to regain the freedom to live our lives without the fear of the virus. We are fighting to allow our economy to operate freely at its full strength. It's a fight that we can win, but only if we can fight it together. Thank you.
Good evening. As just announced by the Permanent Secretary, we have 4 new cases to report. And sadly, of course, last night, one of our patients, a patient from the recent McCoy cluster, passed away. With the latest cases and recent deaths, there are now 52 active cases in isolation facilities, 6 are border quarantine cases, 33 are of local transmission, and 13 are under investigation to determine the source of transmission. Of course, cases under investigation are considered as community transmission unless proven otherwise. So now, Fiji has had 165 cases in total since we first recorded a case on March the 19th of 2020. We've had 109 recoveries and now 4 deaths. Due to the recent cases reported at Fiji CDC, the most recent testing data is not yet available. However, as of yesterday, a total of 70,732 laboratory tests have been conducted for COVID-19 since we started testing last year. And our daily average of 1,772 tests per day over the last 7 days, with 1,910 tests as announced yesterday. The weekly average is 8,529 tests per week. Our overall test positivity is 0.2%, and our 7-day daily average test positivity is 0.33%. We're doing an average of 2.2 tests per 1,000 population daily, averaged over the last 7 days. The news today has not been good, and unfortunately it hasn't been good for quite a while. We've sadly had another death, and our sincere condolences are with the family of the deceased. And we have more cases appearing in the community without links to other cases. All indications are at this time that things will get worse, likely a lot worse, before they start to get better. We've also had cases of COVID-19 at Fiji CDC. Now, for me, that hits at a more personal level, because Fiji CDC, the people there, they're my team. In ordinary times, I would be up there at Fiji CDC, at Mataika House, all of this week, previous weeks. But because of what's happened, the outbreak, for the last month, I've been here at Ministry of Health headquarters. And the only reason that I can be away from my team for so long is because they're such a wonderful team. They go above and beyond, and they've been operating like this for over a year now. I'm not there at Fiji CDC tonight, but believe me, they are in my thoughts. And to everyone watching tonight, for all healthcare workers, including the Fiji CDC team, please listen. Please wash your hands with soap and water. Please stay home. Please wear a mask if you do leave the house. And download the Care Fiji app if you have a smartphone. We may not do everything perfectly all the time, but believe me, we're all doing our very best to try and keep you safe. Please help us. Thank you.
Bolovanaka. So today is day 28 of the current outbreak. But health services continue to operate in all the divisions of the country. Our screening and contact tracing work continues. And in the last 24 hours, our stationary screening clinic screened a total of 4,048 individuals and swabbed 270 individuals. Our mobile community screening team screened a total of 20,071 in the last 24 hours and took 701 swab, bringing to a total of 388,526 individuals screened to date, with 10,845 individuals swabbed. Our targeted mass screening for the containment areas and contact tracing continues. For our community isolation facilities, in the last 24 hours, we added Nakasi Health Center as a new isolation facility for the Central Division, and we now have a total of 68 individuals in 4 community isolation facilities cared for by our team. At Lautoka, the Punjas Health Center, VCC Health Center, the FEMAT Field Hospital, the Hospital Ship, MV Webueti, and the antenatal clinic at the old MSP building are fully operational. Lautoka Hospital continues to operate as a COVID hospital and has continued the screening of its staff with no new cases identified to date. The FEMAT Field Hospital is fully operational, and in the last 24 hours have continued with admissions and surgeries for patients from Lautoka. As we prepare to hunker down for the tough days of strict lockdown and extended curfew hours ahead, let us spare a thought and a prayer for our many frontline teams who will be in operation to track down and contain the virus, guard containment borders, and the communities to ensure that we stay committed and safe, assist those in urgent need, undertake necessary screening tests and laboratory tests, care for our family members in our hospitals, and can we also say a special prayer for our COVID-19 positive cases and their families who will need all the support they can get. We can ensure that this effort is successful by staying put and not moving, guarding our own individual home and work bubbles, and practicing COVID-safe measures at all opportunities. Unabalevu and good evening.